All right, Christy, I know we talked a little bit before, but still, can you like introduce yourself a little bit?
Sure. Yeah, so my name is Christina Christie, and I've been a physical therapist for about 36 years, and also have been a childbirth educator in the past, and currently treat in a patients in a clinic called the Physical Wellness Lab in Glenview, Illinois. And then also am faculty for the Gray Institute, teaching the female chain reaction course across the globe for the Gray Institute. And then also, when the female chain reaction course was developed back in 2006, I also had developed a rehab fitness tool called the Pelvic Core Pro. And that is something that, again, is being used worldwide in rehab and in fitness. And I can share a little bit more about that as we go along in regards to training pelvic core neuromuscular system. But pretty much have spent a lot of years working with both female and male patients, pretty much everyone who has a pelvis, and working to improve their pelvic core neuromuscular system function.
Nice, nice, nice. So, um, maybe I'm wrong, but like pelvic floor is not it's not a huge topic, at least like where I'm at right now. So what got you into like the whole pelvic floor muscle?
Yeah. So from the time when I started working with all of this, yes, it was kind of less of a spoken about topic. I had one of my clinicals when I was in PT school with a women's health physical therapist that was in the Chicagoland area and worked with patients with pelvic floor dysfunction, was able to be in the labor and delivery room and work with laboring patients to help improve their birth outcomes. And all of those components led me towards exploring more about pelvic floor function and about both female and male health. In 1992, when I met Gary Gray, I was also taking a number of different, what we would call at that time, women's health courses. Now, many of them are referred to more as pelvic health courses because of treating basically the spectrum of all different types of patients. And basically saw that there was a gap between the pelvic health world and the orthopedic world. I've always worked in outpatient type physical therapy, and in many situations, nobody would ever ask questions about anything that was going on with pelvic health of their patients. And then my own mother actually had severe pelvic organ prolapse, which affected how she functioned through her life. And seeing that she really was never offered anything beyond surgery, I saw that again, there was a gap that needed to be filled in regards to improving continuity of care for these patients, but also bridging that gap between both the orthopedic and the pelvic health worlds. Because when I first graduated from physical therapy school, if you were an orthopedic therapist, you pretty much didn't talk about the pelvic floor. If you were a pelvic health physical therapist, you kind of did everything around the pelvis, but then for didn't really fully understand because they weren't teaching it at that time, how maybe subtalar joint function or thoracic spine limitations would impact the pelvic floor. Now, over the last 36 years, I've seen growth in both areas, and many more people are actually speaking about pelvic health. And we can lend that to a lot of social media that has actually started the conversation, which is great because every day, pretty much, I will have a patient, if they are new, that will say to me, I never knew that I could get help for this. And they aren't necessarily being referred by their physicians, but because they then hear from a friend or see something on social media, they're like, oh, well, actually, I'm having those same type of symptoms. And then they inquire about pelvic health and then they finally seek care. but I'd love for that to be a more readily spoken about topic because we're dealing with muscles and we're dealing with different systems like the urinary system, the digestive system, and the reproductive system. And when they are influenced by biomechanics, if we just understand what those biomechanics are, we'll better serve the patients and the clients that we're working with.
Nice, nice. Love it, love it. So, talk to me about like, I mean, the answer is it's gonna be it depends, but like,
Mhm.
talk to me about like some of the symptoms that if like either male or female that like struggle with pelvic floor muscle uh function or dysfunction. Like, what
Yes.
are some symptoms they're gonna have to deal with?
So with the populations that you currently work with, and yes, I started primarily working with female patients, but then saw that there was a great need in the male health population. And I treat both female and male patients. And when we speak of that, we speak to basically anybody who, again, has a pelvis, and we're talking about biological, either male pelvis or female pelvis, because no matter how someone may identify, right, then we want to just be clear that we're not saying anything out of disrespect to anyone, but we are talking about mechanics in the male pelvis, mechanics in the female pelvis. Now, when you ask about symptoms, if we were to talk about some of the clients that you work with, I see a lot of male patients that will have groin injuries, hip labrum injuries, sports hernias, back pain, SI joint dysfunction. They might have had a history of ankle sprains. And now all of a sudden the mechanics are different in regards to loading to the hips and the pelvic core neuromuscular system. So for the male population, if we're talking about sports and athletic type injuries, usually they are having pain somewhere around the pelvis. So like I said, a groin injury, an adductor strain, a proximal hamstring strain. And when any of those type of injuries happen, that can influence how your pelvic core neuromuscular system is functioning. And then they might have potential urinary symptoms. They might have bowel type symptoms. They might have actual pelvic pain. And interestingly enough, if we talk about the male population, you actually have a muscle called your cremaster muscle. That muscle originates from the internal oblique, one of your abdominal muscles. Now, that muscle basically encases the scrotum. And I will have male patients that have pain shooting into the anterior hip, the medial hip on the inside of the hip, or into the pelvic floor, and they don't know that this could be a pelvic floor component. And if they see someone and they don't have the right questions asked, they might not offer up some of the information of what they are experiencing. So we have to know what questions to ask in order to uncover those symptoms. So that speaks to bladder health, that speaks to bowel health, that speaks to sexual function, that speaks to anything that is painful or doesn't feel right. So in the male population, many men will present initially with groin pain, back pain, hip pain. And I've had many male patients referred to me as a pelvic floor patient, but then we uncover that they have a hip labrum tear, or they have a sports hernia, or they had a very severe proximal hamstring injury or adductor injury. And it's a piece of the puzzle. And once we comprehensively treat that, then all of those symptoms get significantly better. If we talk about the female population, females will have, again, urinary type symptoms. Maybe they have urinary leakage. Maybe they have urgency and frequency. Maybe they have bowel dysfunction, where maybe it includes constipation or a lack of control. They might also have pain with sexual activity. Many times, women first experience something like this when they actually go through pregnancy. and then they have symptoms during pregnancy or after pregnancy. So those type of things can happen throughout the spectrum of either a female or a male's life. And we actually see symptoms in young children as young as like 6 to 8 years old, where maybe they have always had issues with either urgency or frequency, or maybe again, they had an orthopedic injury and now something's happening within the pelvis. So again, if we know what questions to ask and we know what are some of the common symptoms, and then what the actual female chain reaction biomechanics are or male chain reaction biomechanics are, then we can uncover those symptoms and get to the root of the cause and not just treat the symptoms, but actually treat the cause so the symptoms go away.
Nice, nice. I like it. I like it. Um, so before this conversation, originally I thought that pelvic floor muscle is only gonna have pain around that area. I didn't expect like things such as like groin injury, things such as like hamstring,
Mhm.
but also could be a pelvic floor issue. So
Yes.
talk to me about like how if a patient or athlete like go to you, like
Mhm.
how would you assess it to like determine if it's a pelvic floor muscle or like yeah, if it's a dysfunction thing that related to that area.
Mhm. Well, no matter what type of diagnosis a patient is coming into me with, I am always doing a total body assessment, but we always start with the questions. So I'm going to ask them questions about their bladder health, their bowel health, their sexual health, depending on their age, of course. And then we will do a gait assessment where I will watch them walk. And I will ask them to walk a number of different ways because being able to see how their hips move, how their ankles and subtalar joints move, and how their thoracic spine moves gives me a wealth of information to be able to say, okay, if I'm seeing limitations in hip internal rotation, well, that tells me that most likely pelvic floor is involved in some way because their hip can't move through normal internal rotation. So we will do a gait assessment. And then I will use something called 3D maps, which is the three-dimensional movement analysis and performance system that is taught by the Gray Institute, and take someone through what we call 6 vital transformational zones to be able to, again, compare sides and compare their own body against their own movement patterns and see if there is a difference from side to side. And then also listening to what they say when I take them through those type of movements. So those movements include different types of lunges with arm swings. It includes different types of single leg balance activities with either toe tapping or with no toe tapping, and being able to see how their body functions while they are moving through space. So that is the functional part of the assessment. Then, depending on what they are coming into me for, so if I have a female patient that is coming into me with the diagnosis of bladder dysfunction or pelvic pain, we usually will also do an internal pelvic floor muscle assessment to determine how are those muscles functioning. The good thing is that we can tell quite a bit from external components as well and functional movement patterns. So for example, if I have a patient that again is coming in with those type of diagnoses, we will palpate and feel things around the lower abdominal region. We'll assess if they have a rectus diastasis, the splitting of the abdominal muscles. We'll assess their adductor mobility. And many times those patients will have significant trigger points in the adductors and in the proximal medial hamstrings. We also can palpate externally medial to the ischial tuberosity. So at the bottom of the pelvis, if you feel your ischial tuberosity and you just move medially and proximally in towards the body, you will assess the obturator internus. And that obturator internus is one of our hip rotator muscles. that hip rotator muscle is connected to the pelvic floor muscles fascially via the arcuate tendon. So if those areas have any type of trigger points or pain or movement dysfunction that you look at and assess during the movement part of the assessment, that gives you more information to say pelvic floor is probably a piece of the puzzle.
Hmm. Um, so I guess my next question is like, so after you assess it's a pelvic floor muscle
Mhm.
thing, like what are your approach to like re-educate it or rehab?
So again, it depends on what the patient is coming in with, but many times providing education about what is normal, right? What's normal bladder health? What's normal bowel health? Pain should never be considered normal. If there's pain, there is something wrong, right? And we should be addressing that. And then being able to give them tools to where they will start where they are successful. So if you follow the applied functional science principles, which again is all the education taught by the Gray Institute, we always start a patient where they are successful. We don't start a patient where they are in pain or where they can't perform a certain movement. And when I first graduated from PT school, that's pretty much what we did. We would always start where somebody had a problem, or we'd start where they were less successful. And then again, did not have as much success with our patient. But if you start where somebody is successful and then move them towards their dysfunction, then we see a change with that. Now, for many of my patients, I will have them use the pelvic core pro ball, which that's this particular pelvic core pro ball, and it provides resistance against internal rotation and external rotation because we put this on the legs right above the knees. And because of the resistance of the ball and the resistance of the band, we are training the hip rotator muscles through variable ranges of motion and with varying resistance. And when we train them that way, we actually get the pelvic core neuromuscular system to activate submaximally and subconsciously, meaning how it actually functions in real life. Because you heard me say the system, pelvic core neuromuscular system, but we really didn't define that yet. So I'll define that for you now, which is the system of the respiratory diaphragm, the abdominal muscles in the front and sides, the back and hip muscles in the back and sides, and then the pelvic floor muscles at the bottom. So all of those muscles are fascially connected and they have to work as a system together. They never work in isolation all by themselves. They have to work as a system. Now, we could start to train the muscles with awareness. Most people have heard of something called the Kegel exercise, which is a pelvic floor contraction. Now, that can be a starting point of bringing awareness to brain body connection. But realistically, if you have someone jumping to dunk a basketball, they're not going to be thinking about contracting their pelvic floor, right? We have to create the environment in which that happens automatically. And that's what we do when we use the applied functional science principles and understanding the female or male chain reaction biomechanics to make all of those connections work together so that the pelvic floor can do its job at a submaximal subconscious level. So we don't have to think about it.
Nice, nice. Um, does does it also affect like SI joint
Yes.
issue or like some sort of like SI joint dysfunction?
Yes. So when somebody comes in with any type of sacroiliac joint dysfunction, we have to consider what's happening within the pelvic bowl. Because if you think of, you know what the posterior chain means, the posterior chain is the muscles and the fascial tissue that starts at the Achilles, goes all the way up our legs, up our back, all the way to our suboccipital space at the bottom of the skull. That posterior chain also influences the sacroiliac joint. So if we have tightness along the way or muscle incoordination where the timing of how everything should work isn't working well together, that's what we have to restore. Because when I first, again, graduated from PT school, I had many physicians that said to me the SI joint doesn't move and that it's a fused joint. Well, we know that that's not the case. The SI joint does have a degree of movement, and technically for the female pelvis, if we didn't have that movement at our SI joint and at the pubic symphysis, we wouldn't be able to birth a baby vaginally. Like we need those joints to be movable. And I myself have felt my SI joint get locked up or go out of place. And the thing that we have to remember is our bodies are always going in and out of alignment, so to say. And usually it self-corrects. When it doesn't and something gets stuck for some reason, that's when we have pain at the sacroiliac joint. So making sure that the posterior chain is working well. But interestingly enough, if I have a patient come in with SI joint dysfunction, many times I'm actually first treating their anterior chain and addressing things in the lower abdominal region, in the anterior and medial hip region, in order to allow that SI joint to function better. So even though we say, okay, start where they're successful, but many times we don't go directly to the issue. We actually go to other aspects of the body to address whatever issue they are presenting with. And if that were to be SI joint dysfunction, many times I'm treating anterior chain and medial hip first, and then going to posterior chain. So just to give you kind of an idea of how we order things, but again, that typical answer, it always depends on how the patient or client presents.
Nice, nice. Um, it kind of already answered this, but still, uh, how do you like, do you think that the pelvic floor muscle or like the whole region gonna affect like how does it affect like athletic performance
Right.
like basketball, track,
Hmm.
soccer, hockey, baseball?
Yeah. So think of our pelvis as like your foundation, right? And if something isn't working well in your foundation, it's hard to actually produce power and performance when our foundation isn't solid. So if you think of how we develop as humans through the first year of life, right? We go through something called developmental sequence. And with that developmental sequence, if somebody has an injury, we can use that developmental sequence to actually reboot their neuromuscular system, which ultimately will help sports performance. So when an athlete has had an injury, many times if we give an example of somebody who has to do any type of impact, a basketball player, a runner, a volleyball player, anyone that has to do a soccer player, any type of impact or quick direction change. If that foundation, again, the timing and the coordination of how our entire pelvic core neuromuscular system has to function, and then also how it manages pressure because it is a pressure system. If that isn't functioning well, then you can see how that would impact how someone is landing and if they're able to land and then recover and move again after landing appropriately. So, for example, if I have a patient that comes in and let's say they had an ACL injury, we will do something called a return to impact program. And that return to impact program includes the different types of jumps, which are 2 feet to 2 feet, jops, which are 2 feet to 1 foot, or hops, which are 1 foot to 1 foot, but it won't just be in one plane of motion. It'll be in multiple planes of motion. Because if we use multiple planes of motion to restore impact, we then are improving how they are actually going to perform out on the court or out on the field because we're creating that environment where there's going to be different direction changes, different ways that they're going to be landing, and not just like jumping in like the sagittal plane, not just jumping straight up and down or straight forward and back, but doing things side to side and rotationally because seeing how somebody lands is going to give us information about their hip. And if their hip can decelerate appropriately, meaning slow down that internal rotation so that they don't just collapse into pronation, if that hip can decelerate appropriately, we know that that's impacting the pelvic floor because it's fascially connected to it. So if there is any type of dysfunction within that pelvic core neuromuscular system, that can impact sports performance and it can potentially make someone a little more vulnerable to injury. If we look at our female clients, there is plenty of research to show that they are actually injuring their ACLs mid-cycle of the menstrual cycle and right premenstrually because of the change in estrogen, and that load of estrogen makes everything a little bit more lax. And when that happens, that will impact how someone can perform out on the field or out on the court. Now, men also go through hormonal changes, not quite the same way as females do, right? But again, we have to look at how is their entire aspect of their performance? How is their sleep? How is their nutrition? How is their warm up? Are they going out into the field or on a court from sitting down on the floor versus doing some quick hip movements three-dimensionally before they go out on the court or out on the floor? Those type of things will impact how the pelvic core neuromuscular system reacts. And when we can do those type of movements and understand why we're doing those movements, that will help ultimately improve sports performance.
This is awesome. I love it. Um, uh, so earlier you kind of mentioned that you're gonna there's sometimes gonna have like athletes sometimes gonna have growing pain
Mhm.
or hamstring injury, and you
Right.
mentioned that you're gonna use the ball to like
Mhm.
test their internal rotation or
Mhm.
external rotation.
Yes.
Isn't that like somehow kind of like uh the adductor squeeze we've been using, but maybe like we've been only looking at adductor instead of the whole pelvic floor or the pelvic core.
Yes.
In
So
in your experience, uh, the groin injury or adductor or like hip flexor injury is in your experience, is it really a lot? Is it really like groin? Is it really adductor or is it really hip flexor or actually it's the whole pelvic floor?
it's really the complex of all of that. Because when you look at your hip flexor, your hip flexor is again fascially connected to different components within the pelvis. And then interestingly enough, the ureters that come from from the kidney to the bladder actually are fascially connected to the hip flexor muscles. So you can see how hip flexor tightness or injury could impact bladder function because of that. When you look at the adductors, they are fascially connected again to the hip flexors and to the pelvic floor muscles. So if we are only concentrating on stretching the hip flexors, stretching the adductors, and only doing a hip adduction or hip abduction resisted type motion. Is it going to help? Yeah, it'll probably help a little bit, but is it going to be as comprehensive as if you were to incorporate the transverse plane? Because your hip flexors and your adductors actually are responsible for more control and movement in the transverse planes than in only the sagittal plane or only the frontal plane. So if we only think of doing what we see typically done, someone lays down on a table and you do a hip flexor stretch with one knee up to their chest and you're stretching the other thigh down. And then you do a hip adductor stretch. Maybe someone's doing a lateral lunge with that, or maybe they are stretching it in a way where their leg is up on a stairway. If we only look at stretching it in one direction and we don't do what we call triplane flexibility or triplane stretching, we're missing the full comprehensive function of how those muscles work. Because remember, 99% of function is really considered subconscious, right? So it has to have the right timing and coordination and movement, mobility and stability, or what Gary Gray would call most stability, right? The combination of both mobility and stability. We need all of that in order to, for example, do an effective squat or do an effective explosive jump or do an effective lunge. All of that has to work comprehensively. It can't just work in one plane of motion. So, I'm not saying that doing one plane of motion exercise or treatment is wrong. It's not wrong. It's just that it should be considered a piece of the puzzle and how we should incorporate these other components. Because remember, all of our anatomy was developed off of a cadaver body, meaning that, they would go around a cadaver body and, for example, they'd squeeze the gastrocsoleus muscle, and gastrocsoleus muscle then would produce plantar flexion, right? And we learned it that way in kinesiology class. However, in real life function, the gastrocsoleus muscle is responsible for extending the knee and decelerating knee flexion, which is completely different than the way we learned that in our kinesiology classes. And it's not that we learned it wrong, we just learned it based off of a non-moving body versus applied functional science teaches everything and assesses everything off of a body moving three-dimensionally through space against gravity and ground reaction forces. And in order to do that, we need to be able to have the right tools, right? So we bring it back to knowing the right questions to ask and then having the right tools to assess and then prescribing the appropriate exercise that is comprehensive.
Nice, nice. Um, we met each other on the Give Zoom call,
Mhm.
and one thing I learned a lot from the Gray Institute is the proprioceptors, especially in the rehab or return to play setting. And in a traditional like return to play or rehab, they focus the main focus is the muscle,
Mhm.
right? So, but in athletic population, everything's like based on timing. Like the ground contact time is like what, 0.15 for average athletic. If you talk about sprinters, like 0.08, something like that. So talk to me about like, after you assess that, how do you introduce, I don't even know if I'm asking this right. How do you introduce like the proprioceptor part into your rehab process?
So when you think of our proprioceptors, right, they are basically our communicators. They have to be able to communicate appropriately in order to, again, for us to function free of pain or free of injury. So, as an example, if I put the pelvic core pro ball on someone and I have them start doing knee rolling exercises, so resistance against external rotation, resistance against internal rotation, they are moving their legs, they're producing that motion from their hips, But by doing that, they're getting an activation through the pelvic core neuromuscular system that they're not even aware of. And they don't necessarily feel it there. They feel the muscles in their hips and in their adductors working. So by getting the muscle groups that are responsible for turning the pelvic floor on, meaning getting it to work appropriately or turning that switch on, we're using resistance against different motions in order to make that happen. Same thing happens if I were to, squeeze the ball in my hands and lift it up overhead and stand in what would be considered an anterior lunge. And then I rock my hands back and forth. I rock them side to side. I rotate them side to side. If I do that by squeezing the ball or pushing out against the bands, I right away am proprioceptively giving information to my core to kick in appropriately. Because in order to produce those motions through my upper girdle, my core has to provide that solid foundation. And if it's not able to do that appropriately, I'm not going to have as good of control through my upper girdle, or I'm not going to have as good of balance because of my core and pelvic core neuromuscular system not communicating as well. So that's the way that we can basically use global movements to get more local activation of the pelvic core neuromuscular system.
Nice, nice. Um, so I guess last part of this question is like you've been in this industry for 36 years, am I correct?
Yes, long time.
Um, yeah. So I mean,
Wait, how old are you?
I'm 30, close to 34.
Okay, so I've been doing this longer than you've been alive. Oh boy.
No, it's but here's the thing. Here's the thing. The industry have been evolving, evolving, and evolving, but somehow like this is just me. I'm biased because I'm a big fan of like Grand Institute. I'm a big fan of Coach Wen, Dan Path, all those guys. Those guys
Yes.
been working in our industry like forever. So I guess my question to you is like, with all the information we have, with all the research we have, with all the technology we have, we're not necessarily like not just athletic population. Like overall, we're not necessarily like reducing any type of injury.
Mhm,
Somehow, like it is getting more and more.
mhm,
And I think coaches, PT are trying to figure out why.
mhm,
Uh, so maybe some like advice for like coaches, PT out there who want to learn more, who want to be as good as you guys are.
mhm.
What would be some advice?
So remember, I've been exposed to the Gray Institute education since 1992. And when I started working with that, I saw such a higher level of success with my patients and with success that happened quickly and where the patient felt it right away. So when you can get a patient or athlete or client to feel the difference of how their body is moving or performing, they right away want to be more consistent with what you're giving them because they see the benefit of what you're giving them. So the old way of training, and I don't even know if I should call it the old way, but the traditional way of treating, you would give certain exercises and the patient would be like, well, I don't feel anything, or I don't feel a difference. And you'd be like, okay, we'll just keep doing it. You will. Well, that's not how it works with applied functional science. A patient or a client or an athlete is going to feel a difference right away, which means they're going to be more consistent with the rehab that you give them or with the exercise prescription that you give them. So the biggest piece of advice for anyone working in the movement industry is to understand full body global motion and how it affects everything locally and how it affects global sports performance or athletic performance or just activities of daily living. Because if you understand chain reaction biomechanics and how when the calcaneus everts and the tibia internally rotates and the femur internally rotates and it turns your hip on, which then turns the pelvic floor on. When you understand that and you know what to do to make that happen, you will see such a higher level of success with your patients and with your athletes and with your clients. So it's not to throw out everything that you've been currently doing. It's to add in all of the applied functional science principle, strategy, technique, process to what you're currently doing. And if you do that, you'll see such a higher level of success with your patients, clients, and athletes. Because when you understand full body mechanics, success is what you're going to see. Nothing works in isolation. Even my temporal mandibular joint is going to affect my pelvic floor because you think the pressure system is controlled by how our glottis works and how our respiration works. So when you understand those components, it's not just understanding separate muscles, separate joints, separate nerves. It's understanding how all of those things function together. And that's the education that we teach through the Gray Institute. That's why I got involved in it, because when I started to see such a higher level of success with my patients, obviously, as a physical therapist, you want to see success with your patients. You want to see them do well. Otherwise, it's not very fun if your patients aren't doing well, right? So when I saw that, it was like, I need to learn more of this. And then finally, when I kept asking Gary all these different questions about female health initially, he's like, you just need to develop this course called the Female Chain Reaction. And that was where that was born in 2006. I've been teaching that for 20 years globally, and to improve pelvic health across all populations. Because when you understand the global mechanics, you take all your other tools and you add that into what you're doing globally, and you'll just see your patients, clients, and athletes perform so much better.
Nice, nice. Well, we probably need to add pelvic floor, the whole pelvic floor region into chain reaction, not just female chain reaction.
Mhm.
And
Yeah,
that's
and
all.
and
Yeah,
they do talk about it, but because there is so much to learn, it's like we do it a disservice if we don't give it a whole separate
yeah,
educational course, you
true.
know. But yes, giving little tidbits here and there is absolutely helpful, and that's why we did that Zoom call too, to inform everyone about the female chain reaction and about pelvic health. But ultimately, like I said, and it'll sound like a broken record, anyone who works with movement needs to understand these components, because then you will just be better serving your population as a whole.
Nice, nice. That's all the question I have for you today. So for those who are interested in what we're talking about, where can they find you?
So Pelvic Solutions is my company. It's Pelvic Solutions, all one word.com, is where they can learn about the Pelvic Core Pro Ball. They can learn about local exercise classes that I teach here in Park Ridge, Illinois. They can learn about the female chain reaction that is taught via the Gray Institute globally. And if people are local to the Chicagoland area, if somebody wanted to come and see me as a patient, they can also learn where I am located through that website of pelvicsolutions.com. Again, I treat patients at the Physical Wellness Lab in Glenview, Illinois. I always have a waiting list. Like right now, I wouldn't be able to get new patients in until like closer to September. So if people are in need, they can always reach out. Or I do have colleagues across the country that did take the female chain reaction and can always reach out if they are looking for someone in their region. And then if somebody's interested in getting their own pelvic core pro ball, we're extending a discount to everyone. And if they want to enter the code save me 10, so SAVEME10 at checkout, then they will save $10 on the purchase of a pelvic floor pro ball if they wish to. And certainly they can also reach me through that website if they want to send an email or have questions. Pelvicsolutions.com is where you would find me for that. We also put things up on social media. So our Instagram page is pelvicore_pro. So PELVICORE_PRO. And I put little video clips up all the time of different matrices, some of my patients that are models when we put them up of what they're doing in their rehab, if people want to see that in a video clip format in social media.
Nice, nice.
Mhm.